Now let's take a look at some of the solids collectors on the chair. The first is located inside the spittoon bowl, underneath the drain plug. It is well worth checking this collector daily, and if any visible debris is spotted, you need to take it inside the stereo room to empty and clean. The spittoon itself can also be detached if you need to gain access underneath the filter basket. Before doing so, you may need to clear the way by rotating the bowl rinse faucet or removing any plastic covers in the way. To take the spittoon out, gently twist and pull the bowl to ease it out from the rubber sealing. If the rubber is dry, it may cause difficulties removing, so be sure to run some water through the bowl rinse to loosen the seal. When putting the bowl back, use two hands gripped against the bottom of the spittoon holder to firmly push it back into place. Another solids collector that needs to be emptied and cleaned daily is at the end of the suction line, located just below the spittoon. The solids collector is attached to a plug that can be pulled out and disconnected. This plug may look different depending on your chair model, but the process is the same. As opposed to the spittoon collector, the suction solids collector is very fine and designed to collect small solids, which is why some practices will often use a light brush to remove small solids stuck between the lining. It is important that there are not large materials entering the suction motor, and this solids collector acts as the first wall of defense. If you find any tearing or wear, it should be replaced as soon as possible. So another thing that needs to only be lightly covered as a part of daily maintenance is the flushing procedure. This is something that should be done for 3 to 4 minutes every morning. This should include flushing of all handpiece lines, the spittoon rinse and cup fill. Ideally, you should also be following a water maintenance system which involves treating procedural water and disinfecting the dental unit, but we will talk about more of this later. So that concludes the general daily maintenance system for the chair. So let's get into the things that we should be doing weekly or during your own regular thorough maintenance periods. So the first part we'll talk about are the suction handpieces. The suction handpieces can be detached by pulling them apart. They should be disassembled and cleaned weekly to prevent any fluid buildup from forming between the parts. These parts maintain an airtight seal thanks to the O-rings that hold them firmly in place. So these O-rings need to be lubricated every time after they're cleaned to prevent abrasion and deterioration. The slider can also be lubricated to ensure smooth control of suction volume. Now if you have one of the older style suction handpieces, the slider pops out by pushing it through the side. Now let's have a look inside the plant room at the suction motor. As well as on the end of the handpiece line, there is another solids collector at the inlet on the suction motor. So to take this out, first switch off the suction motor by flicking the power switch to off. The blue light on the switch will turn off. Turn the yellow plug anti-clockwise to pull the filter out. Now you need to take this to the stereo room to clean and empty it. This needs to be done weekly, and again, you may find it helpful to use a light brush to clean small solids out of the mesh. So now we're going back to the chair to have a look at the oil gasket. Underneath the delivery there is a collection container that can be removed by unscrewing it from its thread. This container is connected to the handpiece exhaust and is designed to contain and filter any fluids going back through the handpiece line. Although it's called an oil collector, nowadays there shouldn't really be any oil collected in here because your sterilizer is generally going to suck through any excess oil in your handpieces. One thing you may find is that the oil collector is filling up with water, and if this is the case, there is most likely a damaged O-ring on a handpiece or motor, which is allowing water to get into your airline. Generally, your handpieces and motors will come with spare O-rings in their packaging that you can simply replace yourself. Now, let's get back into biofilm maintenance. At Leading Dental, we offer a complete range of products and services to help you manage biofilm buildup in your dental chair. The most important being our 2-part weekly maintenance system, which includes the use of Alpron and Bilpron. So this 2-part system is daily use of a decontamination agent, which is treating water going into the water lines, and weekly or bi-weekly use of a disinfectant agent to, over a weekend or holiday, treat and protect your dental unit when it's not being used. So let's talk about Alpron, your daily maintenance agent. Alpron is a liquid concentrate made for the continuous maintenance of the water quality and procedural water lines. Alpron is physiologically harmless, and safe for procedural use. We would recommend you use Alpron in all water that runs through the chair to decrease the chance of biofilm formation in your water lines. The Alpron dosing is 10 ml to 990 ml, so roughly 1%. At the start of your day, fill your procedural bottle with the appropriate dosage and use the bottle contents throughout patients until it is empty and then repeat. At the end of the day, we recommend taking the bottle off the chair, emptying the remaining contents and allowing the bottle to air purge overnight. Doing this allows the bottle and the bottle hose to air purge, leaving no room for biofilm to form. It's important to make sure that you are keeping the bottle nice and clean, as it's the source of all your chair's water. On the other hand, Bilpron is a ready-to-use liquid disinfectant that detaches and breaks down organisms inside the water lines of your chair. Bilpron use is recommended weekly or bi-weekly, as it is important to give the dental unit water lines a shock treatment to decrease the chances of future buildup of biofilm. The best time to use Bilpron is on a Friday afternoon, as Bilpron requires a minimum of 12 hours in the unit water lines to be effective, and the longer you leave it, the better. It's great to use on holidays or when a chair is not being used for a long period of time. Bilpron can be left in the chair for up to 3 months. So, when using Bilpron, the Bilpron concentrate is not diluted when put into the chair. From what we've seen, about 100 ml in your bottle should be enough to flush through each handpiece and triplex line, and depending on your chair model, the spittoon and bowl rinse. Ensure that as soon as the blue indication of Bilpron comes out of the handpiece line, you switch to the next line immediately to minimize wastage. Once that's done, you can turn off the chair and remove the bottle, leaving it to air purge over the weekend or holiday. Now, beyond the physical application, how can we measure and maintain biofilm? At Leading Dental, we can supply you with dip slide testers that you can use to observe the microbial counts in the water coming out of your dental unit. Keep track of these recordings to see the effectiveness of your biofilm care system. We would recommend doing a test at least twice a year, and when you take the test, ensure to use multiple samples across your triplex lines, handpiece lines, and if applicable, your cup fill. So that sums up, in brief, our biofilm maintenance procedures at Leading Dental. Remember, every dental practice operates uniquely, and it's your job to adopt the best methods for your dental surgery. Our processes are just a guide based on our experience to date, and they may change over time.